Keris Myrick, everyone here who is working to address mental health awareness in our community, because so many people are struggling in silence, and I was one of them. So when I found out that, our mayor, our senator, and even Obama, he was speaking out about this. This gave me the courage to also speak out as well as a suicide prevention advocate. And so two things I do want to ask. One is, so when you talk about the prevention and the early intervention piece, as a legislator, what can you do to get the education system to implement mental health into the education for the prevention and early intervention, and also implement support groups within the classroom in the regular day-to-day schedule? Because if their parents may be even working against them, because if the stigma is so strong with the parents will not be advocates for the kids. And I was one of those kids who fell through the cracks. But I'm glad that I did not die by suicide.
You did not.
Here today.
Thank you. I'm so glad too. Look at you. You're powerful. Powerful.
And then the second question I had is, so I finally have a job. In the last 3.5 years, I've been doing so much volunteer work as a peer. And one thing about accessing mental health care, even regular health care, is if you do not understand your insurance, you will underutilize it. Insurance companies do not always provide orientations for individuals. And so how can we help improve the insurance companies so that people can access the health care that they need? I made over 60 phone calls to help me help myself when I had my own 3-day mental breakdown 3 years ago. And every phone call, because I said I was not suicidal, they said, sorry, we can't help you. Here's another number, here's another number, here's another number, here's another number. And so if my struggle was that difficult, imagine how much more difficult it is for immigrants who are not fluent in English, and people, seniors and people with disabilities. And so that's why I'm so happy that I work in a job now, finally, that helps to promote How Many Connect. Seniors and people with disabilities, they can get a care coordinator to help them navigate the healthcare system, navigate Medicare and Medi-Cal. And so when I go out and share my story, I'm like, I'm so glad I can share my story in my job.
What is your name?
Emily Wu Trong.
Emily?
Yes.
You're an incredibly powerful advocate. I don't know if you know that. I'll be silly. Well,
I'm going to the MHS meeting.
so you asked a few questions, and maybe I just take one of them, the school-based services. If I were to broaden your question, I would ask it, what do we do to change the culture of schools and public education so that mental health is sort of embedded as a normal part of helping kids become strong emotionally so that they can learn? And we got a long way to go. I know I come from this policy bias, but I think if we can demonstrate the best evidence-based practices that show how embedding therapists and other mental health professionals in the schools, in the classrooms work, to evaluate those programs, to demonstrate positive, better educational outcomes and behavioral outcomes for young people, and then highlight those stories, and then go to the legislature and say, this works. Take some of that Mental Health Services Act money, take some of that Medi-Cal money, take some of that healthcare money, put it together. Maybe go out to the private sector and say, match the money that the public is willing to put up. And then let's get those services in schools across California. That's the way you create something. The insurance industry, Let's save that for the next conference.